before, we're here to talk about COVID, and then at the end we'll answer any questions you guys have. I'm Dr. Lastovich, and Dr. Bowman's on the call as well, and then our colleague Dr. Tan worked on the presentation with us. We're pediatric residents at Cohen Children's Medical Center in Queens. All right, so just to, again, let you guys know who we are. We're pediatric residents, and we work with children, obviously, and in the pediatric clinic and in the hospital at Cohen Children's Medical Center. But we're not experts in federal and New York State regulations for a head start. And so today, first, we'll talk about COVID and sort of what is it, which is something we all hear in the news or on social media often, but we just want to be very clear about things that we know and things that we don't know, and then symptoms you should look for in your child and in yourself. And then Dr. Bowman's going to talk about things we can do to keep our community safe, especially with numbers going up across the country. And then here in New York, you know, not as much as other places, but we still want to do what we can to stop the spread and keep our children safe, and our adult population safe as well. And then we'll have some time for a Q&A after. All right, so what is COVID-19? Back in February, this is the question everyone was asking, and we kind of still ask it to ourselves most days. So the name of the virus is SARS-CoV-2. It's a new strain of the coronavirus. Coronaviruses have been around for a long time. Many of them cause just a common sort of cold symptoms, but this SARS-CoV-2 virus causes COVID-19, which is the name of the illness that the virus causes, which can be mild to severe respiratory distress. And it spreads from person to person through droplets. We'll talk a little bit more about that on the next slide. So how is COVID-19 spread? Inhaling respiratory droplets from an infected person, which is why we're wearing the masks, to hopefully stop some of those droplets. The virus is contained in those little pellets of basically spit that come out of your mouth when you talk. You don't always see it, but it's there in the air. And then another way that you can get COVID is from touching a contaminated surface. So someone coughed into their hand, they touched the subway railing, then you touched the subway railing, and then you touched your eyes, your nose, your mouth. And so the virus was introduced into your respiratory system. Next, yeah. So what are the symptoms in adults? Fever or chills, we've heard a lot about. Taking temperatures when you go into public spaces is a common screening tool that we're seeing pop up a lot of places now. A cough, shortness of breath, or difficulty breathing are more common symptoms. Muscle aches or body aches, if anyone here has ever had the flu, you know what that feels like. It's different than being sore after the gym. And then vomiting and diarrhea we've also seen, as well as a loss of taste or smell, which is maybe a more specific symptom that we'll talk about a little later on. Next slide. Okay, yeah, so these are the big ones to look out for. Again, I have a chart going later on that kind of compares COVID to the flu to a couple other things so that we can be more specific when we talk. Next. So what about in kids is the big question. We've heard a lot in the news about how kids, you know, at the beginning it was kids aren't as severely affected. And, you know, thank goodness. But what do we do when they do get COVID? And then we started hearing a couple months later on about kids getting really sick a couple weeks after they got COVID. So the most common symptoms in children are a fever and cough, or any of the adult symptoms that we talked about on the previous slides, or or many children have little to no symptoms and you wouldn't even know they have COVID. Next slide. And so this is the chart I was alluding to, where we can kind of compare. On the left here are all the symptoms that we know COVID can cause. And then throughout the rest of the chart lists different things like strep throat, the common cold, flu, asthma, and allergies. And these check boxes are the symptoms that they have in common with COVID. So if we look at the flu, it shares all of the common symptoms except that one of shortness of breath. And this is why we're really encouraging everyone to get the flu shot this year, because we'd rather you not get the flu, because if you did, then you would get a cough, fever, sore throat, show up to the emergency room, everyone thinks you have COVID, and then you end up getting COVID, you know, somewhere along the way rather than just the flu that you could have taken care of at home. So we'd encourage everyone to get the flu shot. I think Dr. Bowman's going to talk a little bit more about that later. So this is just to compare some of the symptoms. COVID is like a great imitator of many things, and we just have to be careful. Next slide. And then what about this inflammatory response? We heard, you know, in February, kids weren't getting sick. They weren't so affected by COVID. But then a couple months later, we had a couple of these cases, especially here in New York, of kids getting very sick after they had COVID. And so it's similar to adults where they have this massive inflammatory response in response to the virus. It's their body trying to attack that virus and get rid of it. And so in children, we're calling it multi-system inflammatory syndrome in children, or MIS-C. And it's a condition where different organs in the body are inflamed because your body's trying to attack the virus and get rid of it. We don't necessarily know the exact cause of why. And it's seen in children who maybe were sick with COVID, had symptoms of the fever and cough, and maybe they didn't have any symptoms at all, but they were exposed. And it can show up a couple weeks later. Some common symptoms of MIS-C are a persistent fever that won't go away. Oh, I think it's on the next slide, actually. So it varies from case to case that we've seen here. And because we haven't seen so many of them, it's a little bit harder to say this is exactly what MIS-C looks like. But the symptoms that children can have and that we've seen at Cohen's is a persistent fever, a rash, bloodshot eyes, abdominal pain that won't go away, swelling of the hands and feet, and swelling of the lips and tongues. So if you know of a child that was exposed to COVID and now they're presenting with illnesses like this, it's important to seek medical care because there is treatment and we can do something about it. Next slide. So all of that is really scary and you might feel panicked like in Home Alone, but don't panic. Next slide. Yeah, okay. So now I'm going to hand it off to Dr. Bowman, and she's going to talk about what we can do about this going forward.
So like Dr. Lastovich said, I'll just kind of be talking about what we have been doing and what we can continue to do to make sure that we're keeping ourselves safe and that we're keeping the children in our lives safe. So I'm guessing there's not a single person here who hasn't had to change their daily behaviors to help combat this pandemic, whether it's staying more physically distant from loved ones, taking more precautions in public, like wearing your masks, keeping your distance from other people, washing your hands more. And then for a lot of people, there's been a transition to either working or for children going to school in some kind of virtual capacity. And then over the last several months, as the start of this new school year has kind of snuck up on us and is now in full swing, there's been a lot of talk about how to really safely reopen schools and whether it's okay for kids to go to daycare, to go to school in person. And if you'll indulge me for a little bit, I'm kind of a data nerd. So there is some data so far to suggest that it is safe for kids to go back to school. So far, most of this evidence has come out of Australia, specifically New South Wales, which is the state that has Sydney, one of the biggest cities in the country. So their first study looked at about 15 different schools where there were 18 known COVID cases. And you can see here, this is looking at the 10 high schools. All of the green are students and the blue are staff. And they had 18 known cases at the start of this study. And of the over 860 people that came into close contact with these 18 cases, only 2 ended up getting infected. So there was 1 in one of these 10 high schools, and then one student out of the 5 elementary schools. So overall, this is a really, really low rate of transmission. And it was seen in another study out of Australia that looked not only at high schools and primary schools, but also early childhood education and care centers, so things like preschools and daycares. And they similarly found there was a very, very low rate of transmission. You don't see like any red here, like so no secondary cases in these primary schools or in this daycare. So overall, they found there were only about 5 known cases of transmission out of over 1,400 people that came into close contact with the known positive cases in this study. So a lot of evidence to show that in general, schools, daycare settings, places where kids tend to spend a lot of their day are relatively safe. And there's actually a study published from the American Academy of Pediatrics in our journal Pediatrics that showed kind of similar evidence here in the United States. So all of this is really encouraging and reassuring, and definitely makes us feel better about kids being able to stay safe. However, the big caveat is all of these different places had a lot of like mitigation factors and precautions that they were taking. So they were doing what I'm sure a lot of us have been told to do over the last 9 months. They decreased the size of the classes or the groups that these children were in so that they could promote social distancing among students and staff. They had really frequent hand washing. They disinfected the surfaces and everything in the schools and in these daycares a lot over the course of the day. And there were a lot of symptom screens, so like temperature checks, asking about things like cough and shortness of breath to make sure that if anyone did have symptoms, they were getting the care that they needed and that they weren't unnecessarily exposing everyone else. So this is all stuff that was done in these schools that should be done in any schools that are open right now, and things that we should continue to do in our daily life. So in looking at how we can stop the spread and how we can keep ourselves and our loved ones safe, big things that we've, I'm sure, been told to do tons and tons of times. I'm going to tell you again. Make sure that you're wearing masks whenever you're out in public or around other people. If you have like one of the surgical masks, like those blue masks, that's great. If not, any kind of cloth face covering works as well. Make sure that you're keeping your distance from other people. Recommended is at least 6 feet, especially around people where you don't know if they've had any type of exposure. Continue to clean, sanitize, and disinfect like surfaces in your homes, especially ones that are touched very frequently. So like things like kitchen countertops, or if there's like a particular bookshelf or something where everyone puts their keys, or like a coat rack where everyone hangs up their coats at the end of the day. And then if you are going into a school or a store or any kind of place of business, make sure that you're following all of their guidelines in terms of health checks. So if they have temperature screenings when you first come in, if there are limits on the number of people who can enter the building at one particular period of time, things like that, just make sure you're following all of those guidelines. And then if you do have any symptoms, make sure that you get them checked out. So first step would be to call your doctor or another healthcare provider just to ask like, hey, is this something I should really be concerned about? Is this something I should seek care for? Or obviously, if you are very concerned or you do have more significant symptoms, going to an urgent care or your doctor, some kind of healthcare provider, to make sure that you're getting yourself checked out, or any kids that might be having symptoms, getting them checked out as well. And then last but not least, continuing all of your regular healthy behaviors. So the things that you would ordinarily be doing just to keep yourself healthy. So washing your hands continues, like, will always fall into this. Trying to have a good diet, get exercise, just all of the regular things that you would do to keep yourself healthy. And there's one additional big thing you can do this winter to help keep everyone safe, and that's get your flu shot. So the flu shot protects against the seasonal flu virus. It does not protect against coronavirus directly. So the flu shot will not mount an immune response and help make you immune to the coronavirus. However, it will keep you safe from the annual flu. And as Dr. Lastovich mentioned, a lot of the symptoms between the flu and the coronavirus are pretty similar. So it will help keep you safe and help keep you from getting some of those symptoms. And there's a lot of really great data to show that if you have gotten your flu shot and you are exposed to the flu virus, you either will not have any symptoms at all, or if you do get symptoms, they're much, much less severe. And then kind of going along with that, this decreases your risk of needing to, go to a doctor or an emergency room, or potentially need to be hospitalized if you were to get the flu and you were to have some of these really severe symptoms that you can get. And most importantly, it just keeps you and everyone around you safe and more protected. So make sure you get your flu shot. So just a couple take-home points. Do your best to stay informed. I know there's a lot of information that's really being thrown at us all the time, some from reputable sources, some from less than reputable sources. So if you have any questions, reach out to a doctor or another healthcare provider or someone from Head Start. Like, people are all around and more than happy to help you. And then keep yourself protected. Keep wearing masks, keep washing your hands, keep social distancing, and make sure you get your flu shot. And then these are just some resources. This is a PowerPoint, so you aren't able to click on the links in here, but hopefully we can get those out to you in some capacity. But the American Academy of Pediatrics, the National Resource Center, Head Start, and the CDC all have great kind of information on coronavirus, and specifically how it's impacting kids and ways to kind of stay safe with schools and childcare settings, reopening, and all of that. So thank you very much for your time. And Dr. Lastovich and I are more than happy to answer any questions that you guys have.